All right. Hello, everyone. My name is Jesse Rosenberg, and I will be moderating the seminar today. If you have any questions, please place them in the chat box on the bottom right so that they can be answered when it's time. After the workshop, please fill out the survey, which will be sent to your email to let us know what you thought of the presentation. Tonight's presenter is Dr. Tawanda Hubbard. Dr. Hubbard is an associate professor of professional practice at Rutgers University School of Social Work, was honored with a National Teaching Leadership Award in Higher Education by JV Educational Consultants in March of 2021. Let's welcome Dr. Hubbard to the seminar.
Thank you, Jesse, and welcome everyone. It is an honor to be here to be one of the presenters at the NAMI Mercer Harvest of Hope 13th Annual Conference. So I am thankful to be here with you this evening. We're going to talk about tonight trauma, and we're going to talk about the need for trauma-informed care and our current social climate. And so I have quite a few slides for us, and so we're going to touch on some things. We're going to unpack other things, and at the end of our talk, I will extend to you, if you are interested in having the presentation, to put your email address in the chat box, and I will definitely make sure that I email a copy of the presentation for you. So let's get started. So I always like to start out with a hearty good evening and welcome. It's 7 p.m. and you have had a full day. And so I hope you are in a place that you are comfortable, right? And that you have your favorite beverage and possibly even a pen and pad in case you want to take any notes. So tonight's presentation, as was described in the description for the workshop, is going to be one that is interactive, but it is a lecture style presentation. But I'm going to be looking for you to interact and respond to me in the chat box, okay? Which I think will utilize a lot of this evening just to get your reactions and your feedback. So I just want everybody to get comfortable. Now, here's what's on our agenda for this evening. We're going to define and discuss what is trauma. We're going to define PTSD, post-traumatic stress disorder, and we're going to talk about this framework and idea, the trauma-informed care. And then we're also going to explore the role of grief and loss in trauma, because a lot of folks miss that when someone has experienced trauma and is struggling with traumatization, that there is components of grief and loss that they experience along with the trauma. And then we're going to connect it to our current social climate and the impact of COVID-19 and the civil unrest that we've been dealing with for close to 2 years. And then we'll talk about some trauma-informed strategies that support persons who experience traumatic symptoms. And we're going to talk about these strategies from the perspective of the personal social domain and the professional domain, because when family members and friends who have experienced trauma are engaging in services and interacting with the system, you need to be able to identify, is this service provider someone who is trauma informed? And then as a loved one, how do I bring trauma inform this framework into your relationship with the person who's experienced trauma? Okay, my chat box went away. Let's see if it'll come back. Give me 1 second. I'm going to go off camera and come back on. Ah, that's the trick. When you go off camera, it comes back on. Okay. Alrighty. So I would like to know, what do you hope to get out of today's workshop? Why did you sign up for today's workshop? If you can put that information in the chat box for me, what intrigued you about trauma and PTSD and trauma-informed care? And please, I want you to protect your personal information, and so you don't have to disclose anything you don't feel comfortable disclosing. And this is a public format, so I just want you to be mindful of that in responding. I think with each slide, Jesse, the chat box goes away. Okay. So if you can take a minute, good. Oh, okay. Marie, someone you know has PTSD. Oh, Kathy, thank you for sharing that. Anybody else feel comfortable with sharing what attracted you to the workshop? Okay. You wanted to learn about some of the strategies to support. Thank you, Carol. Okay. We're definitely going to talk about that. And then also too, just what is, trauma and PTSD. We're going to get into it. And there's a couple other diagnoses that I'm going to touch on tonight so that you're aware, so you can look at it on a continuum. Okay. Anybody else feel comfortable sharing? I don't want to move on if I don't give an opportunity. Everyone, thank you, Annie, to support a friend, Madeline. I think this most traumatic period of American history that I've experienced. Yeah, there's a lot that's been going on, and we've definitely been feeling it individually, family, community, as a nation, and as a global community as well, right? We've been impacted. Okay. Thank you, everyone. So I just want to be mindful as we are communicating with one another in the chat box to be mindful to respect confidentiality of individuals, groups, communities, and organizations you have a relationship with. So what that means is I don't want you to disclose anyone's name, right? I want you to protect everyone's confidentiality. I want you to protect the confidentiality of folks who are in our virtual room. So if anybody shares anything in the chat box, let's keep it in the chat box, right? Be mindful not to shame, blame, or criticize anyone for their experiences, questions, or comments, right? I want to create a accountable and safe space for everyone this evening. And then let's be mindful to be non-judgmental, right? Because as human beings, we are meaning making creatures. So we judge all the time, but we have to cultivate this stance of being non-judgmental. So let's just be curious about the ideas we're talking about this evening, and let's just be curious about one another, right? And we can create a safe space for everyone to engage. Is everybody in agreement? If you can just let me know in the chat box that you're in agreement. So just put okay, agreement. Good, very good. Very good. Thank you, everyone. Good, very good, because that's important to create a accountable, safe space for all of us. Because we're going to talk about trauma this evening. So our focus is really zeroed in on understanding trauma. What is it? And the different dimensions to it, and understanding trauma-informed care. That's what our main focus is, right? So I'm curious about, how do you define trauma? Because we all kind of have a working definition that we carry around with us when we talk about what's trauma. So anybody in a few words you want to be able to describe, can you type in? So what's trauma? You can put it in the chat box. It might take a minute to type a little bit. Anything that disturbs your life. Ooh, I like that. A hardship lived. Okay. All right, Josh. A situation immediate or ongoing that elicits strong emotional reactions. Okay. Trauma is what people go through, which disrupts their life. A negative that we relive over and over. Yes. You guys are hitting it. Very good. All right, I'm going to give you some language here, and you can see when we talk about trauma. So I want you to understand a little bit of the history of where the concept comes from. So initially, trauma was a medical term referring to a wound. However, it did begin to be used as an emotional wound, talking about trauma. And so by definition, when you think about trauma, people think about emotional trauma. And so you think about the emotional shock that produces this lasting kind of effect on a person. But I will tell you that in our present day, people use trauma all the time, and they misuse the word trauma. So you can have folks standing in a ShopRite line and they stand too long, and because they are tired or stressed or irritated, they can say, oh, this is so traumatizing. And that's the misuse of the word, because when we talk about trauma, right, it's not just about a highly stressful event. Look at that fourth statement there. The key to understanding a traumatic event, it refers to extreme stress. So when we talk about trauma, we're not just talking about something that's stressful or highly stressful. Trauma speaks to extreme stress that overwhelms a person's ability to cope. So it really overwhelms our ordinary systems of care. So we go through our day and have highs and lows in our days. We experience stress, right? And so we have ways of coping with that. We've cultivated and learned ways to manage and negotiate our day. When it comes to something being experienced as traumatic, those ordinary system of care that we've cultivated and created, they just don't work, right? It overwhelms us, and it really leaves us with this sense of powerlessness and helplessness when you're talking about something being traumatic. And so I want you to be very clear, because you will hear people talking about trauma, and that's not really trauma. That's just high stress. So with trauma, it's extreme stress, and it disrupts. So I like some of the language in the chat box. It kind of disrupts, and it interferes with one's functioning. That's when somebody has been traumatized. Now, I will tell you, there are no clear divisions between stress, which leads to trauma, and stress that actually leads us to learn to adapt, right? Because it's very, very individualized, which leads us to my next slide. So when you think about it, if you look up top, it's not possible to make blanket generalizations such as X is traumatic for all of us who we go through it, because believe it or not, one event can be traumatic for one person, and for another event, it can be non-traumatic for that another person. And so it's very subjective and very individualized what is traumatic. So we can't just assume, which some people do. Some people can hear that somebody got robbed at gunpoint. Some people can hear that somebody, their house was burglarized and they were home. And you would automatically think, oh my goodness, that's traumatic. But it depends on that person, what is traumatizing for them and what is not traumatizing. And so you cannot assume that details or meaning of an event that are most distressing for one person is the same for another. What do you think about that? Does that make sense for folks? Because you will find people, the story just sounds so intense, the experience, and people will jump and be like, oh my goodness, that must have been so traumatic for that person. Not necessarily. It really varies. Just like, for example, so I am a certified child sexual abuse therapist. That's one of my hats. And so I hear this all the time. So there are people who will just say, oh, well, that child, the adult only exposed them to videos of porn, or they just touched them. There was no penetration, and they go to minimize that effect. But I have worked with children who were extremely traumatized by being just touched and not penetrated, and even extremely traumatized by the grooming process, right, of showing videos. And so it really varies for folks. What do you think about this? Very good. I see you guys in the chat box. Okay. Now, if you look over at my gray box, when I talk about what is trauma, like I said, it manifests, well, it's perceived differently, but it also manifests differently. So I'll talk to you in a few moments about symptoms and behaviors that you might see or people might report to you, right? So it's not just about the severity of the event, but it's also about the way we process it. So we all have different perspectives and different world orientations and views. All of that factors in to how somebody identifies and perceives and interprets something as being traumatizing. And again, like I said, those individual subjective experiences, interact with people's personal, psychological, and social environment. All of that factors in to how you experience and perceive something traumatic. And then Judith Herman, Dr. Herman, she's like a guru in the world when we talk about trauma. And so for her, when she says trauma is the conflict between the will to deny horrible events and the will to proclaim them out loud. So she talks about the struggle that people find themselves in, what's happening for them internally, and then also to make that a reality, right? So she says that's kind of what trauma is in her opinion. Now, from SAMHSA, this is a formal definition for trauma. So when we talk about what trauma is, it refers to intense, overwhelming experiences that involve serious loss, threat, or harm to a person's physical and or emotional well-being. And please pay attention to the language, serious loss, and it can be a threat, right? So something just there not actually happened to them, but the idea that it might happen to them, as well as it can be actual harm. And so if you look over to the box to the left, these experiences may occur at any time in a person's life. They may involve a single traumatic event, or it can be repeated over multiple years, right? And so I'll talk to you about that as well. How's my pace? I hope I'm not going too fast for you. We just have a few slides that I want to make sure we get through. Okay, I'm just checking to see in the chat box, is my pace? Okay, very good. Thank you. Now, this is what might be seen for people, what might be experienced, or what might be reported to you. So you got to think about on the behavioral level that people can just blow up at the slightest correction, right? Fighting when being criticized or teased, right? They can be perceived as being very sensitive, resisting transitions or change, right? And so anything abrupt or quickly changing things, very protective of their personal space. They might be perceived as being reckless with their decision making and behaviors. They need more reassurance, right? Because when someone has been traumatized, along with that can come victimization, what has been done to them, and in that process, not feeling safe, right? Not feeling that sense of control, and so might need reassurance, right? And people can misperceive that and think they're just seeking attention, but they're seeking that sense of comfort. They've disconnected from that feeling. And then also too, there can be some regression back to younger behaviors, where you might even find someone who sucked their thumb when they were in elementary school. They're now sucking their thumb again, and they're an adult, right? Or an adolescent. When you think about on the emotional, physical level, nightmares, sleeping problems, sensitivity to noise, right? To touch, like there was a woman who had been raped, and it had been some time after the tragedy had happened, and her son went to touch her from behind. She elbowed him really, really hard, really, really good. And so, because of being alert, being startled, just a very different orientation she has now in the world when it comes to her safety, right? Um, so fear of being separated from family because of protection, a difficulty of trusting others, especially if what has happened to the person happened by someone who they did trust, or there was an expectation that this person wouldn't harm you, like a loved one, a family member. Their emotions can be all over the place. They can be at different intensities now. Sometimes when you go through a trauma, a victimization, there are emotions awakened in a person that they had never felt before in their lives, like rage can awaken in them. And then unexplained medical problems. So they can have somatic complaints where their head is hurting, their tummy's hurting, they're feeling all types of aches and pains in the body, and can't really explain it. And then, of course, the psychological level. So confusing what is safe with what is dangerous now because they don't know. They might not be trusting their judgment, right? Trouble focusing and concentrating now. They're distracted, right? Because there's all types of things popping into their head, which we'll talk about. And they can have difficulty imagining the future, right? Because they are they're troublesome. They fear that they're not safe, right? And depending on if this was a single event or this has been repeated, right, can affect that difficulty of imagining their future, one that can be a safe future at that, right? So very important to understand that. Now, when we talk about the onset of symptoms, when do you start to see those behaviors, emotional, psychological issues that begin to come up for folks? So the symptoms can appear immediately after they've been exposed or years later. And usually it's in response to a trigger. And so the way I like to talk about it is like you never know where the minefields are at, the landfills in the mind, right? You never know where they're at, those mines in the landfill, excuse me. And so people get triggered by them, and other folks might not know what's triggering to a person. You don't know, especially if that's not someone that you really know like the back of your hand because you have an intimate, close relationship with them. So an example is an adult survivor of childhood abuse, right? So they have not had any issues. There's been no symptoms of trauma, that the trauma affected them in a negative way. But then they have a child, and that child reaches that same age that they were abused, then you might see some symptomology. Their behavior might change even towards protecting their child. And so it starts to kind of show years later, it could be, right? And so following the onset of symptoms, usually they're characterized as either chronic or recurrent. People can get a diagnosis of PTSD if left untreated. But this is important. I want you to know there are some people who do recover from being traumatized without getting formal treatment as well, right? So I do want you to understand that as well. Okay, so let's go a little bit into PTSD. Right. So post-traumatic stress disorder. Now, I wanted you to know a little bit of history about the term so that you can be familiar with it. And so when we talk about PTSD, its first appearance was in the 1980s, right? And it was introduced into the DSM-3. So the Diagnostic Statistical Manual of Mental Disorders, it's like the Bible for mental health practitioners, right? It was created by the American Psychiatric Association. And when we think about PTSD, it comes that legacy of from Vietnam veterans when they were coming back from active duty, and it was called shell shock, right? And so the shell shock, they were seeing that they had certain symptomology, and the symptomology that they had, they first labeled it shell shock. Some people called it soldier's heart, war, neurosis. But eventually what was coined was post-traumatic stress disorder. And a lot of people don't realize it was really important to create this construct of PTSD because it allowed for people's experience, number one, to be named, not left invisible. Also, even though there was a lot of controversy around creating PTSD, um, it really made a significant change because a lot of the diagnoses in the DSM um, are defined as being located within a person. So it's like a biopsycho issue within a person. And and sometimes people look at those as being an inherent weakness in a person. But PTSD and the stress related disorders really highlight that it is an external cause that has caused an external event or issue that has caused this person to have these symptoms. It is nothing attached to anybody having an inherent type of weakness, right? And so it's outside of the person, which to me is very powerful to be able to define. Does that make sense for folks? because I don't think we talk enough about that to understand. Also, too, when you define PTSD and utilize PTSD as this construct, it helped people to be able to obtain benefits that people need to have. And so I think it's very important for us to understand it. Any questions about PTSD? Any questions about trauma? I'm just checking in. Everybody's clear? Okay. Thank you, Kathy. Thank you, Carol. Okay. So when we talk about PTSD, post-traumatic stress disorder, that's the clinical official diagnosis, right? And so there are four categories when we talk about PTSD that's important to know. The re-experiencing symptoms that people will have, like intrusive thoughts. So when we talk about intrusive thoughts, you don't invite those thoughts. You're not engaging in those thoughts. They kind of just pop up in your head spontaneously. Flashbacks, where people feel like they're back in that same moment when the trauma happened. And then nightmares, very extreme nightmares. Some people even have what we call sleep terrors, right? Night terrors, right? And so it can be very intense, sweating, they're fighting, right? Very intense. Protective reactions, emotional numbing, not wanting to feel. Some people have amnesia, they forget, don't want to remember. And then cognitive avoidance too, they go to distract themselves, busy themselves, you know, it can also lead to people engaging in certain behavior to not remember, right? So some people, there's a history, well, not a history, excuse me, there's a connection between trauma and people who utilize substances, right? And so, because they don't want to remember what happened to them. And then those arousal symptoms, easily startled, hypervigilant, always scanning, making sure, looking that they're safe, no danger. And the negative emotion and cognitions was added to PTSD in this fifth edition that we have of the DSM, right? So the fifth edition was published in 2013, and they added this fourth category because it used to be just the three, but the fourth category speaks to negative emotions and cognitions. And when we use the word negative, it's not in the sense of good or bad. It's in the sense of the difficult emotions, the challenging emotions that people struggle with, like shame and guilt and anger, rage, really difficult. And for some folks, sadness could be a difficult emotion for them to experience and to feel. And when we talk about the cognitions, the way people might talk to themselves, how their worldview gets changed, where they don't think the world is safe anymore, they're in danger, they might think they're a bad person. Right. So there's a lot of things that come along with it. And so it's important to understand because you can see or hear people talking about themselves in this manner that is negative. So here I have a couple slides that just actually I pulled the criteria in from the DSM-5 so that you can see it. So the first piece, we're not going to unpack everything here, but the first part here, exposure to actual or threatened death, serious injuries, sexual violence, they need at least one of these to qualify for PTSD. They need to be directly they experienced it or they witnessed or they learned about a traumatic event that occurred for a close friend or family or they experienced repeated or extreme exposure, right? And then they need the presence of one or more of the intrusive symptoms that I talked about. Um, Also, they need the persistent avoidance or stimuli associated to it. So that avoiding, that numbing, and then the negative alteration in their cognitions and mood, right? And so you'll see an inability to remember important aspects, right? The persistent and exaggerated negative beliefs or expectations about themselves, others in the world. And it goes on, even to persistent negative emotional states, right? Feeling detached, an inability to experience positive emotions, right? So all of that is a part of post-traumatic stress disorder. Now, what's really key here is that PTSD is not diagnosed in a person until after a month or more, right? So within that first 30 days, they don't get diagnosed with PTSD if they're having symptoms. PTSD comes after a month or longer, and it needs to show these symptoms really have a significant distress and impairment to a person's ability to function. Because people can have some of these symptoms, but if they're mild and they're not disruptive and interfering with their life, they might not get a diagnosis of PTSD. And so I really want you to understand that. And if you move over here to the square at the bottom to the right, sometimes with PTSD, there are other diagnoses that people will get. So, like I told you, you know, how sometimes they have those physical complaints in the body. So, the somatization, excuse me, they might get that, psychosis, anxiety disorder, and even major depressive disorder, they might get along with PTSD. And sometimes, too, they might get a substance use disorder as well. Okay. Now, PTSD also has developmental sensitivity to children. And so, children 6 or younger can get a diagnosis of PTSD, and it'll show up a little bit differently. So, often in little ones, we'll see it in their repetitive play, some of the symptoms being acted out. The threshold is a little bit lower, but it does mirror everything that I just unpacked for you for adults. And also, if you look at the bottom of the screen to the lower left-hand corner, complex trauma. Now, complex trauma is not in the DSM. We hope one day it will get in the DSM. But when you talk about complex trauma, you got to think about how children are exposed to multiple traumatic events. And they tend to be invasive in an interpersonal relationship, usually the caregiver child relationship. And it speaks to the wide range long terming, and it affects them across so many domains. So, attachment and emotions, cognition, development, and usually it is pervasive experience of abuse and profound neglect that they are experiencing, right? That leads to complex trauma. And it also impacts the way their brain develops. Very important. Now, acute stress disorder, this is the diagnosis that a person will get if they are experiencing the symptoms and it's been within that 30-day time period. So it's the same symptoms, but it's the duration. So they'll get acute stress disorder. So you might hear somebody, a family member share, this is the diagnosis that they got. And then also too, there are some folks who won't get PTSD. They won't get acute stress disorder. They might get something that you heard called adjustment disorders. You might hear that because somewhere in there, you know, people still have a strong reaction to major stressors in their lives, and they can have excessive feelings of anxiety, mood disorder, not disorder, excuse me, depressive mood, antisocial behaviors, which are more like criminal behaviors, right? They can have that symptomology, but it doesn't elevate to the level of PTSD or acute stress disorder. And so it is adjustment disorder. It kind of falls in between there, right? Where there is some disruption, but it is not as intense as PTSD or acute stress disorder. And so here I just kind of told you how people can get that coded differently. They can get adjustment disorder with a depressed mood or with anxiety, whatever they are demonstrating. And so I wanted you to have that language. Now, who is most likely to develop PTSD if they experience an extreme stressor, right? First of all, it depends on the magnitude of the stressor, the intensity, the duration of how long they are exposed to it. Those who experience stressors with a sexual assault component are most likely to develop PTSD if they have limited support. Those who are in a social environment that produces shame, guilt, stigma, or self hatred that they struggle with, they're more likely to develop PTSD. And then those who have concurrent stressful life events already going on in their life, they're already in a compromised state before experiencing this traumatic event, they're most likely to develop PTSD, right? Now, I would like to show you a video because I think it's so important to bring voices of folks in who experience and struggle with PTSD. It's a very short video, but I want you to be mindful because you're going to hear some people share a little bit of their narrative of what their experience, right? Okay. So, Jess, if you can just let me know with a thumbs up that you can hear the video, that would be great. Let me just make sure.
It's like living with a leash on a little bit. You can do some stuff, but every now and then you remember that it's there.
I was living in Japan during the earthquake in 2011.
A few weeks and months of political unrest while I was living overseas. We lived with bags by the door ready to go in case we needed to get out.
I found out in 2008 I had PTSD, complex PTSD, but I think the diagnosis should have probably been made when I was 14 years old.
I was raped, and as a result, I live with PTSD.
The civil war in Lebanon broke out in 1975. I was only 17 years old. I lived through that for about 12 years.
As it kind of sunk in, I started to feel really guilty because I had always associated PTSD with people who had been to war, and I just didn't think I deserved it.
The PTSD triggers, they ambush you. You don't know when it's gonna come. It's sort of the unknown. Every day you wake up and you don't know if you're going to have a trigger today.
I was at a movie, and there's a part where this woman got trapped in a car. I had a serious panic attack.
There was a song that was talking about like shooting and armed robbery, and just hearing that song, that was all it took.
Something happened when I was 13, and when my trigger happens, in that moment, I am 13.
Usually the sounds of jet planes overhead would trigger off the memory for me of those days. It would make me feel weak in the legs, and my memory will go back to that time trying to look after my children when they were little and protect them. Yeah, all I had to do is hear a jet plane, and that's where my mind will go.
At times, it has literally felt like I'm dying. You feel like you're never gonna get past this. One of the things that's helped me a lot was group therapy. This happens to more people than you think.
Start to have a conversation with this thing that you have.
I did counseling for 2 years in college, and it felt like that got my life into a pretty manageable place.
I am trying to build up the courage to attend a support group.
I would have these days where you're just like, there's nothing I can do to do anything that you're supposed to do. In group therapy, someone called it a lost day. It's such a simple thing, but putting the words lost day to those days helped me overcome.
And I think accepting that is really important, and just being like, it's okay to freak out and just be like, oh, this is scary, because it's scary.
And don't ever tell them to get over it, because it's extremely painful.
It takes practice, and it takes patience, and it takes faith. You have to know that the fact that you've been through something so traumatic and you're here, you are much stronger than you think you are.
Don't feel guilty when you have a good day.
Give yourself time to heal.
You can't judge yourself for it.
It'll never be the same, but it can get better, and it's worth whatever it's gonna take. You can have a better life.
There is a light at the end of the tunnel. You just got to find the right thing that works for you.
And getting help is not a sign of weakness. It takes a lot of strength and a lot of courage, and you deserve the happiness that comes with getting better.
My name is Kate.
My name is Tammy.
My name is Kirk, and I live with PTSD.
Any reactions or thoughts? Mm-hmm. So I see a question in the chat box about anxiety. So I want to answer that. So anxiety, so you have to know there are normal levels to anxiety, right? So anxiety and anxiety disorder are two different things. We can, when you talk about anxiety, you're talking about just an uneasiness, a tension that you might feel, and people tend to feel anxious in unknown situations and those what if moments, and that's okay. And there's a such thing called positive anxiety that can lead you to prepare more, and then there's different levels of anxiety before it gets to that disorder, right? But, when we talk about the disorder piece to it, it speaks to, again, the duration, the intensity, the frequency of it, and if it is interfering in someone's life. Now, PTSD, it has that stress component, that anxiousness in it. So it is PTSD and stress related disorders, and it comes under that umbrella of the anxiety disorders. It does. And so, but you can have people, if it's not a traumatic component to it, like I explained the criteria for PTSD, people can experience anxiety and worry about stuff, and it can be normal, but if it goes with the intensity, the duration, the frequency, and it interferes with their functioning and development and impairs their ability to function, it's not connected per se to a traumatic event. You can't tie it to that. With PTSD, that criteria I explained a little bit early on this slide, this makes the difference for PTSD. Where's it at? Here, this first part, the direct exposure, experiencing, witnessing, learning, that is key here. That's the difference between them. Where anxiety, you can be having this excessive worrying, and it can be generalized, and there's different kinds of anxieties, social agoraphobia, and different things that you can have with anxiety disorders. So I hope that helped to clarify
It's
that. Any other questions anyone have before we move on? Yes, a family member's death could be traumatic for someone if they did not expect it. And the way the person died, that could be traumatic because they're bearing witness to it if they were there, or even if they heard what happened to the person, it could be traumatizing. So when you think about PTSD, it can be a direct experience that happened to the person, or something that you witnessed or even heard about, right? It very much could be. Okay. So here I wanted to bring into our conversation just our social climate. We've been going through a lot in the United States and globally. And so when you think about the civil unrest that we've been dealing with, when you think about COVID-19, we're still in a pandemic, even though there's several parts of our country that people aren't wearing masks, people aren't still socially distancing, and we still have people contracting COVID. We have not reached that herd immunity that they told us in the very beginning that we needed to reach. We also have people in the Black and Brown community who, through interactions with law enforcement, are losing their lives. We have Texas that passed that restrictive law on abortion. So when you talk about reproductive rights and justice, and then, hurricane season that we're in, and the last storm we had, Ida, caused so much damage, including the tornadoes in Jersey, where people lost their home. And we just celebrated the anniversary, remembering 9/11 20 years later. And so we're going through a lot, right? We're going through a lot here in our nation. And there's still more. This doesn't cover everything that we're dealing with. And so when you have someone who has experienced a trauma, and then we're in the midst of, you're watching videos of George Floyd being killed, being murdered. We are hearing the counts of people dying due to COVID-19. it was so much anxiety that was rising when we were shelter in place, because some folks live alone, right? And so, we have to take in consideration our social climate, and we have to keep in mind how COVID-19 civil unrest, it complicates matters even more for folks who have been traumatized. So when we talk about those triggering situations for people, what triggers people. And so we have to be sensitive and mindful to that, right? Anybody have any thoughts about how COVID-19 and civil unrest can complicate matters even more for people who have been traumatized, have PTSD? Okay, let me get my chat box. Any thoughts? Do you think it's a valid point to be sensitive and mindful about how the pandemic could affect people, and even how some people who might have even experienced the pandemic as traumatizing, being told to shelter in place, right? Not we didn't immediately have access to hospitals, right? Because they were overwhelmed. We saw our infrastructure of our medical system being overwhelmed, right? Yes, it definitely escalated fears. Yeah, that's right. That's right. I see it, Jesse. And so, that's a struggle. So that can take people back and can cause a flashback for folks back to that place where they experienced that initial traumatic event. Because remember, a part of feeling traumatized is feeling powerless and helpless, right? And so here is this virus that we're all fighting, right? And so it can be scary. And then when we got the vaccination, for some people, it's scary to think about taking the vaccination, so they take the risk and still wear masks and socially distance and wash their hands. So we're still struggling in this, still struggling, right? And then on top of it, you still have Black and Brown communities still in fear when it comes to interactions with law enforcement and just safety in the community. So it's a struggle. It's a struggle when you talk about traumatizing, because there are so many people who felt traumatized watching the videos, social media, and, being exposed to seeing George Floyd dying, and then hearing about other folks being shot and killed, Breonna Taylor, Ahmaud Arbery, right? It's just a lot of death, and that can be for some people traumatizing, right? For some people in the Black and Brown community not feeling safe themselves because of their skin color, right? So we have to factor in grief and loss, and I'm keeping an eye on time because, like I said, with trauma, there's this grief and loss. And so I just want you to think about how loss and grief are a part of being human. They're connected to our capacity and ability to love and bond and attach to people, things, and places. And so they also provide for us a connection to who we are. Um, what things mean to us, our goals, our dreams, a sense of security. And so when we lose them, we will grieve. And what really differentiates grief from other reactions, it's important to get, is our love and meaning that we give to people and places and things in our lives. So this is so important to understand loss and grief, right? So the more we love or need someone, a place, or a thing, the more she, he, they, or it will mean to us, and the longer we're going to grieve about it. And so that's so important to understand how loss and grief is connected to our ability to love and attach and bond, right? Also, too, when you think about loss is at the heart of just life and growth and living. So in a broad sense, loss is something that causes one's life to change in a significant way, and we have to learn to adapt to it. But it's so important to recognize, just from a developmental perspective, as life change and we mature, we experience loss, right? And some of that is just natural. It's just a part of natural human experience and living. Now, what's really key is to understand the difference between primary and secondary losses. So primary losses are like pretty obvious loss, like if you lose a job, if you lose a person or an object, that's primary, it's obvious. Secondary losses are those what we call hidden losses, and that speaks to the meaning and the value that you attach to something, right? So some people can maybe think you should be over it already, but because how significant that was, the meaning that was attached to what you lost. So even for example, people don't realize if someone has been raped by a stranger, there could be a hidden loss there of just safety walking in their neighborhood, and what that meant to them to just walk around safe and not be concerned that someone can harm you that way, because we see and hear about things, but they're on TV. When it happens in your life, it makes something very real for you, which is important to understand that. And so grief is a complex emotion that a lot of people don't understand it before they actually feel what grief is. And it is a real profound feeling of sadness and pain that people have. And it's important to understand that it can be a range from being mild sadness, right? That takes just a few days because you miss someone, you lost something, to actually suffering that can take people even a lifetime. Some people never get over grief. It's something that they live with. Right? Just like you heard those folks say, I'm living with PTSD. So it's important for us to understand and be sensitive to that. And here, this slide, I just wanted to summarize when we talk about grief and loss, the emotion of it, an outsider can see it. They can observe it on you. Feelings are not always observable. People, that's a very private experience. People might not always show that they're feeling some kind of way. And when we talk about grief, it can be something real or imagined or anticipated. So when someone has experienced something traumatic, right, they can be expecting that it's going to happen again and anticipating that. And so it's so important for us to understand the dimensions. And so these particular slides here, if for folks who want the PowerPoint, you can read them, but I wanted to give you information because there are emotions that have like a negative connotation to them, like denial, anger, guilt, anxiety, depression, and fear. But when it comes to grief and loss, they have protective functions. There are defenses that we have that get activated that help us kind of understand, like anger and hostility is a self-defense mechanism. This emotion helps to protect you because there's certain expectations you have for the way the world should operate, right? Guilt makes you consider your effectiveness in the world, and so it's like a self-appraisal that wonders if you were competent and how could you let something happen or occur like this. And then we go on and on. Let's look at anxiety here. Awakens an awareness of a person's inability to control events. The person may feel he or she should have been able to prevent or at least predict the occurrence of loss. So it's important to understand when we see people having these emotions, what they mean, and the functionality of these emotions, because it really connects to this journey of grief that people go through with also experiencing trauma, right? So when the loss occurs to them, what parts that they might have lost, there's a shock. There's a tragedy. There could be denial and anger. And then after a while, there's suffering, right? And their energy gets absorbed in the pain and the situation, and they can turn molehills into mountains, right? And there are highs and lows with this, but then they move on to survival, right? Where they become a little bit more emotionally stable, right? The tragedy no longer absorbs all their energy and attention throughout a day, but this is a gradual process. It's not quick. But then when they reach stability, the beautiful part about stability is that whatever that loss is, it loses the power the loss had on them, loses its hold on them. It diminishes, right? And so then they're reinvesting their time, their energy back into life, right? And so it's so important to understand this process of grief and loss. Very important if you're supporting people. Any questions? If you give me a couple more minutes, I have a few more slides for you. Let me just check in to see if there's any questions. Some people had to give up their independent living due to job loss and go back to their families where they had their trauma trigger. Very true. Very true. Could very well be so that they went back into a space or place that triggered it. And so these people need support. And so here is where it's so important for us to keep in mind the way we communicate to people in a relatable way. Because, like Maya Angelou said, people can forget what you said and what you did, but they'll never forget how you made them feel, right? And so here, you know, I don't know how many people know Brene Brown. She talks about empathy in a way of being is about connection, because you probably heard empathy described as being in someone else's shoes. But the way she talks about empathy is not being in someone else's shoes per se, but connecting with the feeling that they're trying to, share. And you got to touch inside yourself a similar feeling. And sometimes it's not about you having words for another person. It's about you just being there and connecting with them and saying, thank you for sharing this with me. And so I'm going to just get to talk a little bit about trauma-informed care before we end. So, as a family member, a friend, even professionals, because trauma-informed care was created for a framework for professionals, but we're going to talk about it as both. It begins with understanding that physical, social, emotional impact of trauma on the individual as well as the professionals who help them. And there's really four elements to trauma-informed care. You need to realize the prevalence of trauma is very common. Recognize how trauma affects all individuals involved in programs, organizations, systems, the workforce, everywhere in the world. Responding to the effects of all type of trauma by putting the knowledge into practice, understanding what trauma is, what PTSD is, what acute stress disorder is, even adjustment disorders. And the goal is trying to resist re-traumatizing people, right? And reading people's behavior through a trauma-informed lens. So maybe that person who is irritable and snapping at you in this moment, maybe it's not personality. Could this be trauma, right? Trying to understand that. Also, I gave a slide to talk about system-induced trauma, because from a professional stance, your family and friends who are involved in getting services, if systems are not sensitive to trauma and how people can be traumatized and the way they behave and respond can be a trauma response, they might, look at the second section here, they might commit acts of a commission where inappropriate, unnecessary kind of, exclusion of people. Some people, sometimes it's very traumatizing. If they go inpatient and you put them in restraints, it can be very triggering. And then acts of omission, failure to consider the impact of trauma on the way people present and function in life. So that's so important for us to understand that. And so we want to resist re-traumatization. And so we have to be mindful as family members, friends, and service providers, right? We have to think about how people get triggered when they feel a lack of control, when they experience unexpected change, something quick, unannounced. When they feel threatened or attacked, they can get triggered. They are feeling vulnerable or frightened. And if they're feeling shameful, that they feel defective about themselves in some kind of way. These are very key areas that people can feel triggered. And if we're not careful, the way we treat people, talk to people, and interact with people, can create this. So if you're very controlling and dominating and you don't give that space for that person, they can feel a lack of control and triggered. And so just a couple of strategies I wanted to leave you with. This is the SAMHSA trauma-informed strength-based approach. And basically, Some key things for you to think about: emotional and physical safety for all. So the way you talk to people, the word choices, the languages that you use, creating that emotional, physical safety. For some people, you can't stand too close to them. You have to be careful how you stand next to people, the direction you stand. It can seem aggressive. Trustworthiness, being honest, doing what you say when you say you're going to do it, keeping your word, all of that's important. Giving people choice is very important to do so. Making sure people can have active communication, respecting people's agency, their boundaries, right? Collaborating with people, very important. Share the relationship with people. Some people are very domineering and controlling in relationship, and people feel very small and minimized and reduced, right? Not getting what people think or feel about something, just doing it for them can be very can be very scary and intimidating for people. And then empowerment, very powerful idea for empowerment, right? So allowing people again to have a say, to have a voice, to have agency, to be able to do something for their own, to ask you and not just you do it for them, right? Creating that space to set them up for success. So keeping these 5 core values are important on a personal, social level, but you should also expect these values too from professionals and organizations that your loved ones are seeking for services, which is really important. And then let me just check the chat box. Just give me a few more seconds. I know I'm a little over. I want to show a couple more slides for you. Risk factors and protective factors are very important too. And so it's important for us to be mindful that vulnerabilities, they feel very sensitive and vulnerable, not feeling things to be safe or people to be safe. And so it's so important for us. We don't do the assessing, professionals assess, but for support persons, how do you help them in self-regulation and co-regulation? Let them come to you. They might need you to help them think some things through and problem solve. Be mindful of they need long-term sustainable healing, and this takes time. Be open to that. It's not a quick done. They need positive and effective coping skills, so support them in that. They need a strong support network, go-to people, and really promote and support them in taking care of themselves. Very important factors that help to protect them. And then here, the goal of trauma-informed care is to really normalize and validate people's feelings and experiences, support them as their own understanding of their trauma increases and the connections with emotional impact, empower trauma survivors to manage their current life, right? And understand their challenges in the context of their victimization. This is what informed care does, right? So for those who want this PowerPoint, please mark this slide. And then a couple other things for you to think about. Creating safety is important. Recognize trauma is always present. Be non-judgmental. It's not what's wrong with you, it's what happened to you that's important, right? Also, too, resiliency is important. Recognize that people are capable of coping. They might need support and time to get there, right? People can overcome, and they can be able to manage and endure and cope and thrive after trauma. Also, to recognize the body. So the body holds a lot of the memories for trauma. And so people need yoga, they need to exercise, they need to walk, right? Um, People might struggle with their sleep. Healthy nutrition is important, but also recognize trauma is not just a private experience. People in the community and neighborhood can be traumatized. And so stabilization is about first focusing on their personal safety, emotional regulation, and then later they can kind of unpack the trauma. People need to get stabilized before they start diving in and unpacking trauma, because you can have somebody really decompensate if you don't allow them to get stable first and then go into trauma work. And then also here, you can read on this, is post-traumatic growth. People sometimes after going through a traumatic experience, actually find themselves better, more whole, more full, more knowledgeable as a result of what they went through. They would not have asked for what they went through, but because they went through it, they have grown and learned from it and through it. They've learned more about their strength, about who they are, what they're capable of, right? And so it's so important to recognize post-traumatic growth when the person with trauma is ready. Don't speak about post-traumatic growth just yet if they're still struggling with it. They're not there yet. And in here, I just bring in wellness because all of that I just talked about, it affects the mind, the body, the soul, the spirit. Wellness is a very powerful idea. I'm not talking about well-being, I'm talking about wellness because wellness speaks about this active, intentional way of pursuing a lifestyle of a holistic health, right? So it's not about being happy, right? It's about this idea of being an active participant in pursuing intentionally and mindfully being healthy. And it speaks to your behaviors and your choices that someone makes when it talks about wellness. And so take a minute and read this slide. You might like it. And this is our last slide, common intervention. So I gave you some medications that people might take with PTSD. They can engage in individual, group, family therapy, usually exposure therapy, EMDR. This idea of cognitive processing therapy is a type of CBT, but CBT is like the gold standard. So you might hear your loved ones and family members talk about these particular interventions. And so I just wanted to give you a little bit of information. And here are the self-help strategies you can help with anxiety and PTSD. And these are some key takeaways to keep in mind when we talk about this, that trauma, grief, and loss may be different for everyone, and that we need to recognize how people might see themselves, relationships in the world after having trauma, and that, it's so important when we interact with people. How can I create a situation in which a person feels safe, makes her, his, or their own choices, and feel understood? That's key to being trauma informed in your relationship with someone. And that's it. Thank you for giving me 10 minutes over. Thank you. Please put your email address in the chat box and I'll make sure that I get you this PowerPoint for those who want it. And if you have any questions, I will definitely hang out. I'm not going to rush off. If you have any questions for me, I'm here. You're welcome, everyone. It's a lot of information. I don't do those oodles and noodles PowerPoints and presentations. I give you a full course.
Thank you, Dr. Hubbard. You were
You're welcome,
wonderful.
Janet.
Wow. We're going to want to have you back, just so you know. You did such a good job. Now you're going to be on our list.
Well, I try to be thorough because trauma is an important topic to
sure.
talk about. And so I wanted to make sure, even if I couldn't unpack everything on the slide, that you got a full picture of when we talk about trauma and trauma informed and PTSD. And
Absolutely excellent. It was
here's the
wonderful.
last slide. Just have a good night and make sure you are the change you wish to see in the world, right? And please enjoy the rest of the conference. I know you have a couple more presentations to go in the conference, but this is wonderful.
Thank you. Thank you so much.
You're
Really.
welcome.
Thank you very much for everything. It was fantastic.
You're welcome. I hope I wasn't too fast, everybody.
It was good. It was
No,
all good.
perfect pace.
Very good, very good. So I see some people giving me their email addresses here. I'm going to save the chat box and make sure that I send them out to you later this evening so that you can have it to review. I just ask folks, just don't copy it. Just don't, just keep it for yourself and talk about the ideas on the
Okay.
PowerPoint, right?
Thank you. Yep.
You're welcome. I see you asked to, Janet. You're welcome. Alrighty. So I'm
All
just
right,
hanging
I
out
will.
here.
Yeah, you want me to keep it open or should I close it out?
Well, I just wanted to see if anybody had a question.
Yep.
If you give them maybe 2 more minutes, just in case. If not, they might be going.
Okay.
I'm just checking the chat box to see if anything else comes up. So I see people said it was informative. Appreciate your knowledge on the topic. Thank you, Josh. People are saying thank you. What else we got? Okay.
Some people also put their emails in the question and answer, just so you know. I don't know if you saw that.
No, I didn't see that.
It's on the.
Sorry, my allergies are starting out. Oh, did
Oh,
they
I
see?
get it, yeah.
Oh,
Oh.
maybe not. Yeah.
I think that was Josh.
Okay.
Let me see. Did anybody else besides Josh put it in there?
Nope. I think that was it.
Okay.
There
Yeah, I
was
think that's it.
there was a question there, Dr. Hubbard. Someone asked, they said, is somatic therapy something you practice?
I incorporate some somatic therapy in
Okay.
because it's just the body work that you do, and it's an approach. So I tend to do a bottom up, but I also do a top down. And so what a bottom up means is, how do you really help people learn about regulating themselves? And then also too, I love to do something called shaking the bones, and I encourage, there's actually trauma informed yoga that you can do and take. And so I encourage people, I don't do the trauma informed yoga, but I do encourage people to participate in that yoga, but teaching people to be mindful of their bodies. And then sometimes people hold certain stress in certain parts of their bodies. And there are people who are trained trauma, how do I want to say it right? Masseuse, where they do massages specifically that are focused, but you got to do your research on it to identify these folks. But it's the body up approach, because it's the idea, and this comes from Dr. Bruce Perry, that you need to regulate first in your body before you can relate to people. And then after you regulate in your body, then you can connect and relate to people. And then you can reason and think things through. That's the bottom up. A bottom up approach. The top down approach is when people try to get you to think things through before helping you learn to regulate your body and building that connection with you. It's a top down. So I try to do the bottom up.
Good.
It's a different way to kind of practice. Okay. All right. I'm just going to put Josh's email in the chat box, so because I can copy the chat box. I couldn't copy the Q&A. Okay. And somebody else just put something else in the chat box. I don't know what email ID is. Well, on my PowerPoint, I'll put my email address. If you have any questions, I can do that.
Okay.
Okay. All righty, we can close it out if there's no more
All
questions
right.
anyone
Thank you very
has.
much for everything. I appreciate
Thank you so
everything.
much.
You're
Yeah.
welcome. Have a good evening,
Have a
everyone.
great
Enjoy
night.
the rest of the conference.
You too. Thank
You too.
you.
You're
Goodbye.
welcome.
Bye.
Bye-bye.